webinar of our medical education and on the platform of PMA and with collaboration of Women Medical College, with the collaboration of Pakistan Society of Physiology, Pakistan Association of Pathologists, and Azad Jammu Kashmir Medical College, Muzaffarabad, very old. And today's especially uh, important topic was on the request of mostly our students and the faculty of the Azad Jammu Kashmir Medical College, Muzaffarabad, and Kangaroo Medical University and others. So this especially very thankful to Dr. Amir Abbas. Dr. Amir Abbas visited me at Lahore, and at that time he was very busy, but I requested him that why not you conduct a webinar for ours, because it is very important topic, and nowadays if we will not learn about the artificial intelligence, I hope we'll be almost behind the world. So starting today's webinar, we usually our starts webinar by the recitation of Holy Quran, and very thankful to Professor Rashid Mehboob Saab, to you are continue with us from the last 3-4 years. Over to you, Professor Rashid Saab, for the recitation
राइट
of Holy Quran.
जज़ाकल्लाह। सूरतुल अनाम की आयत 32 तिलावत करता हूँ। अऊज़ु बिल्लाहि मिनश शैतानिर रजीम। बिस्मिल्लाहिर रहमानिर रहीम। वमल हयातुद दुनिया इल्ला लइबुन वलहव वलद्दारुल आखिरतु खैरुल लिल्लज़ीना यत्तकून अफला ताक़िलून। तर्जुमा है, और दुनियावी जिंदगी तो एक खेल तमाशे के सिवा कुछ नहीं, और यकीन जानो कि जो लोग तकवा इख्तियार करते हैं उनके लिए आखिरत वाला घर कहीं ज़्यादा बेहतर है। तो क्या इतनी सी बात तुम्हारी अक्ल में नहीं आती? ये कुरान मजीद में कई मरतबा है कि और अक्ल से काम क्यों नहीं लेते और सोचते क्यों नहीं हो। तो अल्लाह ताला ने इंसान को जहन दिया है, दिमाग दिया है, अक्ल दी है। अल्लाह ताला का हुक्म है कि इसे इस्तेमाल करो। तो डॉक्टर आमिर अब्बास बताएंगे कि अगर आर्टिफिशियल इंटेलिजेंस भी आपने इस्तेमाल करनी है तो अपनी अक्ल के साथ उसको इस्तेमाल करें, उसका अंधाधुंध इस्तेमाल ना करें। सदाकल्लाहुल अज़ीम।
Jazakallah. Thank you very much, Dr. Rashid Mehboob Saab. Very beautiful recitation of Holy Quran and the sayings of the Quran. आप देखें कि आजकल सोशल मीडिया, व्हाट्सएप, गूगल स्कॉलर्स, आर्टिफिशियल इंटेलिजेंस, ये फिफ्थ जनरेशन आ गई है। तो क्या देखें हम अखलाकियात से कहीं गिरते तो नहीं जा रहे इतनी तरक्की के बावजूद। एक बात, वन थिंग अनदर थिंग इज, देखें अगर आप देखें ना आज की तरक्की, तो अगर हज़रत सलमान अलैहिस्सलाम के जो नबी थे उस दौर की तरक्की देखें तो वो कहीं ज़्यादा थी, और उनका अदब, उनके अखलाकियात जो थे वो आज की इस तरक्की से भी कई गुना ज़्यादा बेहतर थे। वो आपने देखा कि उस ज़माने में एक उड़न तश्तरियाँ उड़ा करती थी, और हज़रत सलमान अलैहिस्सलाम ने अपने जब किसी जिन को कहा, जिनके पास थोड़ा सा इल्म था, कि वो हज़रत मलका सबा को लाएं, तो उसने यूं किया और उठा के वो हज़ारों किलोमीटर दूर उस मलका सबा को आपके साथ पेश कर दिया। वाकई इंसान उस तरक्की करता है, लेकिन उस तरक्की के साथ साथ ऐसा नहीं है कि अपनी एथिक्स को और अखलाकियात को, अपने किरदार को वो अपना भूलता जाए। सेकंड थिंग आर्टिफिशियल इंटेलिजेंस का दौर ऐसा आ जाता है हमारे यहाँ कि पूरी दुनिया फिर इस तरीके से उसके पीछे पड़ जाती है कि वो बाकी चीज़ों को भूल जाती है। तो ऐसा है कि हम क्या वाकई पाकिस्तान के प्लेटफॉर्म पे एज ए डॉक्टर्स हम आर्टिफिशियल इंटेलिजेंस एज ए तालिब इल्म, एज ए कंसल्टेंट, एज ए टीचर, हम आर्टिफिशियल इंटेलिजेंस को किन किन मराहल में यूज़ कर सकते हैं, कितना यूज़ कर सकते हैं, और उसकी कितनी एथिक्स हैं, एथिक्स उसकी क्या है। तो आज हम हमारे साथ यंगेस्ट हमारे स्टूडेंट्स हैं, हमारे दोस्त हैं, हमारे कोलीग हैं, डॉक्टर आमिर वास। ये डबल मास्टर किया हुआ है इन्होंने, और एक मास्टर माशाल्लाह इन्होंने अमेरिका से किया है जिसमें उसने आर्टिफिशियल इंटेलिजेंस में। ये बल्कि KMC के ही तालिब इल्म हैं, पेशावर के तालिब इल्म हैं, लेकिन ये माशाल्लाह एक ब्रिलियंट किस्म के एसेट्स अब तक पाकिस्तान है। ओवर टू यू
वेबिनार हो रहा है
आमिर अब्बास।
आर्टिफिशियल
बट
इंटेलिजेंस।
आई रिक्वेस्ट अदर पीपल टू म्यूट, अदरवाइज मैं म्यूट कर दूंगा सबको। म्यूट योर माइक्स, कि आपकी आवाज़ डिस्टर्ब ना कर दे। ओवर टू यू प्रोफेसर डॉक्टर आमिर अब्बास साहब।
Okay, Assalamu alaikum everyone, and thanks a lot, Dr. Mulazim, for such a good introduction. And I would like to thank you, Dr. Mulazim, for giving me this opportunity to speak on this occasion. And I will request everybody to confirm that are you able to hear me clearly?
Yes, you are edible.
Okay. So it's a very humbling experience because I have to speak in front of one of my teachers, प्रोफेसर राशिद साहब, जिन्होंने हमें फिजियोलॉजी में पढ़ाया था। सो रिकॉर्डिंग करने से पहले उनसे ये बात हो रही थी। Before I start, I think your normal routine ये होता है कि when I'm giving a talk in a room, so I will go around the room and I will want to have everybody's introduction. Obviously, that's not possible over here because we are online, and additionally, if we have to go through an own introduction for of each one of you, it would take around 15 to 20 minutes. So what I would request each one of you to do is that to type your introduction in the chat box so that I know that whom am I talking to. So when you're typing your introduction in the chat box, what I want to listen from you is that, okay, what's your name, what is your designation, and from which city you are, and what are your expectations related to this topic from today's talk. So that will help me to navigate through this. So I will request each one of you to please introduce yourself. So in the meanwhile, what I will do is that I will start to share my screen. Okay. So as the introductions are coming up, I'm going to share my screen over here. Right. Can somebody confirm to me that you can see my screen?
Yes, it is we are looking your screen and you're audible to everyone.
Okay, thank you very much. So as Dr. Mulazim said, artificial intelligence these days is a booming area. It's a very, everybody is talking about it. And if I'm being very honest, uh, there are very few people who are formally qualified to talk on the topic. And when there are areas like artificial intelligence where there are very few people who are qualified to talk about it, then there are a lot of rumors related to that. So what I'm going to do is that I'm going to choose a very specific topic, which is the ethical use. Okay, you can use artificial intelligence, but we have to use it ethically, as was very rightly pointed out by Dr. Mulazim in the beginning, and then also a very important point which was raised by Dr. Rashid. I'm also going to come to that. But the essence of our topic will be the use of artificial intelligence, specifically ChatGPT and large language model. But specific assertion is on the word of ethical use, because okay, everybody will be able to teach you how to use, but I'm gonna be more asserting on the point how you should not be using it, and when you can use it, when you should not use it, right? So this discussion will be divided into two parts. The first one will be I'll be talking. This is a very short slide deck, which is going to set the stage for it. And then I'm going to go directly to the platform of ChatGPT. I want to spend more time on giving you some hands-on examples of how can you use or how you cannot be using ChatGPT for this. So first of all, ChatGPT is a type of artificial intelligence that is based on something which we call as the large language model. So we're going to talk about what is large language model, how it works, and then we're going to come to ChatGPT. Okay, so what are the large language models? Right? So large language models are advanced computer programs designed to understand, generate, and interact using human language. They're built using vast amount of text data. They can perform a variety of language-related tasks such as answering questions, writing essays, summarizing text, and even engaging in conversations. If I have to explain it in very simple words, before ChatGPT era, which means that maybe around 2 years back, if you have to talk to the computer, you need to be understanding and you need to know the computing languages. Only computer scientists were able to interact with computers. But now what has happened with the innovation of ChatGPT, apart from many other things, it is empowered English speakers or normal humans language speakers. Like you can even type in Roman Urdu, or you can type in any other language, and you can literally talk to ChatGPT, and you can elicit responses from that. So that's the very simple explanation of ChatGPT. Sorry, the large language models. And large language model works at the back end of the ChatGPT. Okay. So for health professionals, think of them as a sophisticated digital colleague, trained to assist with information processing and communication, tasks capable of analyzing and generating language-based data, much like a highly skilled medical scribe or researcher. So just, for example, you can just think of it that, okay, you give it some data and it gives you some response, right? But now the question arises how it works. It works before ChatGPT, this was all already getting done, but in the era of ChatGPT, this task has become more sophisticated and it works. The information get relayed in, say, and just I will use the analogy of a hospital. For example, if a patient comes to the hospital, what happens is that the patient first goes to the outpatient department, and then and the patient goes through some labs, and then maybe some radiological work is required to be done, and subsequently the patient may be admitted to, say, one of the departments, say surgical department. Then the patient is shifted to OT, and then the procedure is performed and so on. So what happens is that this large language models process information, the input, the processing, and the output of information is processed in different departments within the model. So, and what are the ingredients of those models? That includes something. First of them is known as attention mechanism. Now, before I go into the details of how ChatGPT works, I think the understanding of the details of this mechanism is not my intention, but just I'm including it just for the sake of completion of this talk. If you don't understand it, just simply know that, okay, ChatGPT is an artificial intelligence system to which you can talk. You give it some prompt, you give it some text, it processes it, and it gives you back some text. That's something which you need to remember at this stage, because it's not possible to discuss all the technical details, and neither is the desire to address all the technical details. But just for the sake of completion, I'm going to go quickly through them. I'm going to spend more time on the hands-on experience related to ChatGPT. So how it works, the first thing which we call is the attention mechanism, which parts of input data are more relevant or more important. For example, when you give some text, now the ChatGPT, the large language models has the capacity to identify within the text that which part of this are more important or less important, and prioritize information. The second important characteristic or the compartmentalization of the process is multi-head attention, which allows them to simultaneously process and understand information from different angles and perspective. For example, if I have to explain it from the medical analogy, okay, if a patient comes, then a radiologist will be interpreting the medical history from a different dimension. A pathologist will be processing it from different dimension. In this way, the multi-head attention means that the information which is given to the large language model, it is understood from different dimensions. Then the third one is positional encoding, which understands the sequential order or the positions of elements within a sequence, such as words, a sentence, or tokens, which means that, okay, if you give it a large piece of text as an input, it's going to interpret all the words in the context of the sentence, all the sentence in the context of the paragraph, and all the paragraphs in the context of the whole of the text input which is given. The next one is the positional encoding that understand the sequential order or the position of elements within a sequence, such as words, a sentence, or tokens in a document, which means that, okay, again, okay, how is the words organized, and what is the importance of one word after the other word? What is the importance of that sequence? This model is very much sensitive to that. So it processes information in a stacked manner. Again, I will keep on sticking to the example of a medical, a patient getting process, as it goes through hospital, it goes through outpatient department, radiology, pathology, and maybe surgical department through outpatient department. In the same way, the information gets processed in different uh, different portions of the model in a hierarchical manner. And there are residual connections and layer normalizations, which means that there are shortcuts in a complex network. Layer normalization is like machine consistent. So what happens is that there are residual connections. If one of the department, one of the section within the model has to refer to another sections, there are relay mechanism within the models which will be able to process that information or connect to the relevant portion in the department. And then the last one is masking, which means that it ensures that when the large language model processes a sequence, it can only see information from the past and not from the future, which means that it is each, in simple words, what this means is that each word, it generates the new words uh, by predicting one word at a time. It's not aware that what will be the next word after the word which is predicting and so on. So it's masked the word which is predicting after it. And now again, if I have to step back, I will just be relying on this. If I understand that this maybe I'm throwing a lot of information to you, so I just don't want to do that. What I will just step back and I will just reiterate the information to you that what is ChatGPT? It's a digital chatbot, which is AI enabled, and you give it some text information. It does some processing in different layers of that that processing is done in different layers, and then it gives you some response. And what are those layers? Uh, these are attention mechanism, multiple head attention, positional encoding, uh, and then stacked layers in large language LLM, and residual connections and layer normalization and masking. Just understand that these are the different sections of different departments within the model, and they work together. The main thing is that all of these work in close integration so that uh, the model is giving you the response which you are desiring, which the end user is desiring. All of these work in close coordination with each other. And with the help of this, what I will want to do is that depending on how much time we have, we will want to go through, I will give you some hands-on examples by going to ChatGPT and see that how much of it we can do. For example, how can we use ChatGPT for literature search? How can we use ChatGPT to reach PhD documents? We can use it for proofreading. We can use it for writing email. We can use it for data analysis that includes advanced data analysis, or we can use to learn some new coding languages like R or Python or SQL. You can use it for code generation, code translation, and if you know some of the coding, you can use it to debug or your code. You can learn new programming languages with it. And initially they were called as plugins. Now they are called as custom GPTs. We're going to talk about that. So what I'm going to do is that before moving forward, I'm going to pause over here and see. I don't want to be don't want this session to be something where I'm the only person who is talking, and I just want it to be a bit interactive section. So I'm going to pause over here and see if there are any questions still here. Anyone? Anyone wants to has a question over here?
Yes, please make it interactive and respond the Dr. Amir Abbas.
Anyone has any question? Did you understand anything till what I said, or you did not understand anything at all? If no, just let me know what portion you did not understand.
I just joined you 2 minutes ago, and I can understand. But can you wrap up what you have said earlier?
Okay, so if I have to, yes, that's a good point. So in order, just to wrap up, what ChatGPT is. ChatGPT is something, it's a chatbot to which you give some text and it gives you some text back. And then Okay, the main question is that how it does it, right? It processes the information in different compartments of the model. And those are the different, for example, different mechanisms we are talking about, like, for example, masking or attention mechanism or stuff like that. Just as a patient is getting, for example, if a patient comes to the hospital, it's for treatment, it goes through different department, and each department does different things to it, right? At the end of the day, the patient gets its healthcare, right? So in the same way, when you give an input to the ChatGPT, it processes, and that process is done in different department, and it give you an output. So that was the crux of what we just said.
Thank you.
Sorry?
जी डॉक्टर आसफा, you want to ask something?
बहुत शुक्रिया, बस मुझे समझ आ गई।
Okay. So if nobody else has any question, what next we will be doing
Assalamualaikum.
is Walaikum Assalam ji.
This is Dr. Sophia from Dow University of Health Sciences. I just wanted to have one question regarding AI because अभी मुझे पता चला था इस टॉपिक के बारे में डॉक्टर मुलाजिम ने शेयर किया ग्रुप पे. So it's now a trend that everybody is telling us about the AI in research. But at the same time, they are also telling us not to use it in the research because it can cause plagiarism. And even since I am a reviewer of many journals, international journals, they also say not to use ChatGPT or any AI chatbot for preparing or generating a review report. So I just want to know how much successful it is till now and what will be the scope of AI in future if we sometimes are allowed to use and sometimes we are not allowed to use it.
Very important question, Dr. Amir Abbas, about Professor Sophia.
So this is exactly the focus of the talk, right? So I just had 15 to 20 minutes before going into the topic. The title of the talk is the ethical use of AI, which means that when can you use it, when you cannot, and more importantly, when you cannot use it. And then there are some gray areas. So that's what we'll be talking about. Or if I have to say that, you have to wait a bit because the whole of the talk is on this thing. So whatever use cases I'm going to tell you, I'm going to be talking on the ethical aspects of it, that, okay, in which scenarios you can use it or in which scenarios you can not use it. But just a short question, answer to your question is that the answer is not very straightforward. There are three categories of use cases. One of the categories is, okay, you cannot at all use AI in those situations. That's the first category. The second category is that, okay, you can, majority of the people say that, okay, you can use in those situations. And the third category is those situations where there is a gray area, and then you may have to either consult someone, or you have to make a judgment call whether to use it or not use it. But we're gonna talk about it in a bit detail in a bit. Okay, so if you do not have any further question, can you see, I'm now gonna go to, can you see ChatGPT opened, a window shared with the ChatGPT open?
It's open.
Okay. Okay, so before I go into further details of that, if some of you have not yet used ChatGPT, I'm assuming majority of, or almost all of you must have at least seen ChatGPT. But if you have not seen it, this is how it looks like, which is a very simple platform, which means that, okay, just like Google is a very simple platform. In the same way, it's when you open it, there is a window where you can type anything and it gives you a response. Depending on, I have the paid plan, but if you have the free plan, your platform may be a bit different from mine. If you are paying for it, then you have this drop down menu where you can choose different models. And 4.0 is and there are different models depending on the use case. For example, O1 is the latest model with advanced reasoning. They say that GPT 4.0 is great for most of the tasks. Then O1 mini is for faster at reasoning. And then there are other models as well. So you pretty much, I like this is GPT 4.0 is great for most tasks with advanced intelligence. O1 is the most advanced and highly intelligent model, but it has a limit even for the paid plan as well. And for the unlimited use of own model, you have to pay $200 per month, which is very high. So that's about the different models. Then if you see to this side, you can see all of your history of the chat. You can see that I use it pretty often, and I've been using ChatGPT ever since it was first. I mean, the very few days. I'm a very early technology doctor, and I started to use it when it emerged, and I pretty much use it almost not on a daily basis, but even I would say hourly basis. I'm a very avid user of ChatGPT. So if you can see over here, they have recently introduced this new feature where you can add a project. For example, if I have to add a project, I can create a project, I can add files. I'm going to talk about that in a bit. If your histories, some of your history is here, I'm going to just to give you an example of how it works is that I can ask you anything. For example, I can ask it, tell me something about large language models, right? So this text which I put it in here, this is known as prompt. And with the help, there is a new field which has recently emerged. I'm just asserting the importance of the input text. The fact that it is known as prompt, a new field has emerged which is known as prompt engineering. And that whole field is designed around how to design different prompts. Though it may feel very simple, but the prompts can be very big, and you can structure them in a way to get the type of responses which you want to elicit. Okay, but this one is a very
Dr.
simplest
Amir Abbas,
response.
if you see
Yes.
here are three signs below, there's attach or something else.
Okay, I'm gonna go, sir, I'm gonna go to that in a bit. Okay, so if you give it a prompt, it is going to give you an answer. I'm not going to go through the answer, but it's obviously the answer to what is large language models. You can go through that. Then, as Dr. Mulazim asked, there are three signs. The first one is that, for example, if you want to upload a file from your computer, say you can upload any file that may be, let's say that may be a PDF. For example, let me upload a PDF file. I can upload a PDF file and I can tell it that read this file. And it is going to read the PDF file. And if you can see that the file which I uploaded, that is a serious article. I mean, serious is a journal from which there is article, but if you can say the name of the file does not include the title, right? But it has automatically read the file. It has extracted the title of the file. It has given me a summary of what is inside the file, right? So
We
the
can
first
get,
one
can we
is,
get the summary? Yes.
yes.
Okay.
Okay, so you just uploaded a PDF, it gives you a summary. And then the next one is
View.
you can view different tools within the ChatGPT. I'm going to come to this one in a bit, the other one. But the third one is if you
Search.
activate the search, okay, I can ask it any question. Tell me the latest.
Any question from the audience?
So I can ask it that if I activate the search, what you can do is that when you ask any question, for example, tell me latest research on ChatGPT, it will in real time is going to search it on the internet. See, it's searching on the web, and then it's going to give you
Good.
Latest. It's working just like Google, but in a way that the information are cited. For example, this is from Wikipedia. This is from Wikipedia, and just as Google, for example, if you do Google search, it gives you information in the form of different links. It's not only giving the information, but it's also organizing it and is giving the links of them. Okay. The third one is that it's going to, for example, it's a Canvas tool, which is an advanced medical writing tool within ChatGPT, in which you can generate content, and in real time you can edit content. DALL-E is another tool in which you can create picture. So I can ask it generate a picture of a Pakistani man, and it will generate a picture. Yeah, just wait. It's gonna generate a picture, and then the richness of the picture will depend on how much elaborate the prompt is. So let's see how good this picture is. So I would say, so I can say generate again. If I ask it that, okay, I'm not happy with the richness of the picture, I can ask it that generate a picture of a Pakistani man wandering in KPK, wandering around between mountains with water in the background and children playing.
ये
So I
आपका
am,
पेड वर्जन है जिस पे ये देख रहे हैं आप, या फ्री है?
जी sir, this is the paid version.
ओ
So so it's generating the picture now. And then this one is the picture. See?
ओ
So
गुड.
it's a generate a picture Pakistani man wandering between mountains. Water is there in the background and children are playing. So it's what do you think about this one? I feel this is very good. So this is another model from ChatGPT, which is known as DALI. It's a model which generates pictures from text. Any question? I'm going to pause over here and let anybody ask any question.
Sir, I have a question related to these pictures which you generated
Can
through
you write, Dr.
ChatGPT.
Sophia, can you write, type the question, or can you speak it?
Okay, sir, I can type.
Okay. Anybody who has questions, Dr. Mulazim, they should type it or what?
As you like, as you like, as you feasible.
I think I'm okay both ways.
Okay. Okay, you can speak, Professor Sophia.
Okay, sir, thank you. My question is, when we are generating pictures on ChatGPT, as you just did in a while ago, so are there any copyrights? And
That's
also one more thing, that is it generated by ChatGPT, or we can find the similar images on Google as well, or the ChatGPT is extracting pictures from somewhere according to the commands we are giving to it?
so, Dr. Sophia, two excellent questions. The first, I'm going to answer the second question first. It's not a copy from somewhere else. It's an original picture generated based on the prompt which you created, right? So it's not a copy of any picture from anywhere else. The second question is that are they copyrighted? The ethical way to uh, uh, to 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 deal with that is that you have to declare that it has been generated by AI, and that is one of the basic principle of whatever you do with AI. You have to declare it that it has been generated by AI. Uh, ChatGPT does not restrict the use of it, and it I'm to be honest, I have to check whether it is the requirement. It is a requirement from ChatGPT, but it's ethical to declare it that in any case, either whether you're generating it through ChatGPT or by any other platform, that this picture was generated through the through DALI, which is the model from ChatGPT. Okay. Any other question before we move
ये
forward? And
पूछा
Dr.
है
Last,
डॉक्टर आमिर, किसी ने पूछा है what is the version of GPT called?
version of
What is this version of GPT? ये वाला, what is this version of GPT called? जिस पे
which
आप
one? The one which I'm
you are using.
generating this picture.
Yes.
This one is known as DALI. DALI. See, the one which is used for generating the picture is known as DALI. DALLE.
Delhi.
Yeah. Okay.
Thank you. यानी दिल्ली याद रखना, दिल्ली और दिल्ली कर दे.
DALI. DALLE. DALI. Okay.
दिल्ली.
If you can, there are two ways to find it. One is to find it over here, and the other way is if you go to this Explore GPT, and you can type DALI over here.
Is this a paid version?
जी.
ये जो आपने बताया डेली, ये पेड वर्जन है कि ये
दिल्ली.
So when you buy ChatGPT का $20 per month वाला जो पैकेज है, उसमें all of these what I'm doing that will come in it, including DALI.
मैंने परचेज किया हुआ है $159 का है, पूरे साल का है। वो पता नहीं क्या।
Right, right. It's the same. It's the same.
हाँ,
So, डॉक्टर मुलाजिम, हमारे पास टाइम कितना है? कितनी टाइम में मैंने अपनी टॉक वाइंड
आप
अप
करें
करनी
ना,
है?
आपका जो आप टॉपिक 1 घंटा तो है आपके पास।
अभी हमारे
आप,
पास 20 मिनट रह गए।
जी जी, आपके पास अभी हैं 30 मिनट्स।
Okay, 30 minutes. Okay. Acha. So then, next things, which are now we're gonna go to interesting areas. One of the question which was raised that okay, with all of this background, with all of this interesting things, we can do with ChatGPT. Then, what is ethical and what is not ethical? ChatGPT. I would want somebody to give me.
डॉक्टर आमिर, इससे पहले मैं क्वेश्चन करना सकता हूँ
जी
कि
सर.
ये हाउ द स्टूडेंट्स, मेडिकल स्टूडेंट्स, undergraduate students can get benefit from this artificial intelligence chat GPT। इसी से
सर उसी
connected,
मैं
इसी
कुछ
से
यूज केसेस
connected
बता
आगे
रहा
होगा,
हूँ. जी
how
सर.
the faculty can be benefited from these facilities।
Okay, so I'm gonna give some use cases. For example, so students can. Uh, there are two questions: how the students can benefit, how the faculty can benefit, right? Um, uh, सर थोड़ा सा जो मैं अभी पोर्शन पे जा रहा हूँ इसको जरा कर लें. कैन यू आस्क मी दिस क्वेश्चन एट द एंड, बिकॉज जो मैं आपको बता रहा हूँ उसके
ठीक है, ठीक।
बैकग्राउंड में ये क्वेश्चन फिर ज्यादा तरीके बेहतर तरीके से आई विल बी एबल टू आंसर. Okay. So can somebody give me an example? Let's assume you want to do some writing on any topic. Can somebody give me a topic? I want the audience to give me a topic. Let's assume you want to do some, maybe you want to write a review article on some anything. Give me any topic.
For example, effect of uric acid on metabolic syndrome.
मेरा ख्याल है
Of
डॉक्टर आमिर अब्बास, इससे ज़्यादा जो आजकल ये ह्यूमन मेटा नीमो वायरस के बारे में आ रहा है, इसके बारे में ये क्या क्या कहते हैं, ये ज़रा थोड़ा सा, और यूरिक
okay.
एसिड वाला भी बता।
So uh, human matter.
मेटा नीमो वायरस, HMPV।
Just a minute, sir.
एंड
Let me bring something up. 1 minute, sir. So what we are doing is that we want to write a review article on human metapneumovirus, and I want ChatGPT to help me make an outline of this, right? So I wrote it. I want to write a review article on human metapneumovirus, make an outline for this narrative review. Okay. So it's making an outline. Okay, so it has made an outline. I'm going to just reiterate the major headings, which is it's talking about introduction, epidemiology, which means the global population at risk and transmission dynamics, virology, virological characteristic, pathogenic mechanism, clinical manifestation, respiratory symptoms, severe complications, differential diagnosis of HMPV, and then treatment and management, prevention strategies. So what do you think? I think anyone who wants to comment on how comprehensive or not comprehensive this outline is. Or if it is missing something, what exactly is it missing?
I think it's amazing. Very impressive.
It's amazing, right? Okay.
It's amazing.
If anybody who thinks otherwise, think that it's missing, is still missing something? No one thinks that it's missing anything? because this is not my area of expertise. I'm totally relying on somebody, maybe like Dr. Mulazim or somebody else who maybe, okay, but
Almost he has provided almost all the informations regarding its prevalence,
references,
with
even, yeah.
everything.
So the heading of reference is also there. Somebody's talking in the chat, and so okay. The consensus over here seems to be, even from the experts, is that it seems to
It is
be
very comprehensive, yes, I think.
it's very comprehensive, right? Okay, but it's also, somebody in the chat said that okay, it's lacking let's assume that okay, it's lacking long-term community impact. Okay, so I'm gonna, and maybe somebody says that okay, I being an AI expert, I will say that okay, and use of AI to control. So I think that okay, these two areas are missing, and then maybe other areas which you think okay, this may be comprehensive, but I will say that okay, these two areas are missing. So what I can tell ChatGPT, and this can be an exercise we can for example, it makes you give it a topic, it makes you an outline for you, and then you talk to an expert, or you being your expert yourself on the topic, you can say that okay, this is missing on this area and this area and this area. You can go through another iterations, or you can go through multiple iterations, and you can say that update this outline to include these areas, which includes long-term community impact and use of AI to control its spread. Okay, so let's see, it is gonna incorporate it. So assuming okay, majority had the impression that it's fine, but if some area is missing, you can tell it to incorporate a particular area, and it's gonna incorporate that area. I'm gonna see somewhere both of these areas which I just gave, it may have been incorporated. Okay, see, so it has added the long-term community impact. So it's talking within the long-term community impact. It has detailed 3-4 areas, which include burden on healthcare system, socioeconomic consequences, public health challenges. Use of artificial intelligence in control and prevention. It has given some areas that as well. Okay, somebody else says that history. You can go through another iteration again. I'm not going to go do that in the interest of time, but you can do another iteration and say that I had history of this as well, and you can keep on going because we just started, and you can, when you're writing an actual review article, you can spend maybe an hour or 2 hours, or even maybe more than that, but you can make a very comprehensive outline. And some of the researchers also say that you can go to the real-time literature to add some areas which are not there, right? But now, one important point. Now the question related to ethics. What do you think? I want each one of you to comment on it in the chat as yes or no. How many of you think generating this outline and using it for your a review article, which is later required to be can be published, is ethical? If you think this is ethical, type yes, and if you think this is not ethical, type no. Okay, no, yes. Yeah, so far only 2 responses. Okay, okay. Okay, so majority of the people is saying yes, and one of them has very correctly said that if use of AI is acknowledged. So I think this is ethical, but you still have to paraphrase it. You can use this outline, but you have to paraphrase the content wherever possible, and you have to acknowledge it that you used AI to create an outline, right? If you do so, in that way, the use of AI is ethical till here, because this is, in any case, if I've not don't have to do it like this is what you're doing. You have created an outline, okay, and you're going to fill the information based on actual research which you're going to do. For example, if I'm going to do research on its epidemiology, I'm going to do research on its prevalence and its incidence, geographical spread, and stuff like that. So I don't see any harm in that, but at the same time, you still don't want to be caught doing something wrong. So in order to be extremely safe, you can declare it, and if you paraphrase it and even don't declare it, I will still say that that's ethical. I mean, you're just facilitating and increasing uh, 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 the efficiency you're using the tool. I mean, if somebody, I would lean towards it being, there's no problem using it till here, unless somebody has a very strong reason to convince me otherwise. Yasir Saab has his hand raised, please.
सर मेरा क्वेश्चन ये है कि आपने कहा पैराफ्रेज करें ना, अगर हम पैराफ्रेज करें भी, अगर हम कोई एआई टूल यूज करें या फिर ह्यूमनाइज करें इसको, तो वहां पे एथिक्स क्या कहती है?
ह्यूमनाइज मैंने टू बी ऑनेस्ट ह्यूमनाइज का मेरा इतना ह्यूमनाइज फॉर अदर्स व्हाट इज ह्यूमनाइज्ड कंटेंट कि व्हेन यू जनरेट इट फ्रॉम AI and then give it to another software which is gonna convert it into human like content which is human, so that's humanized. If you humanize it, it's still gonna get detected in the AI detectors. That's one thing. Second is I would not, I don't recommend humanizing. I don't recommend using platforms using humanizing it. Having said that, I don't see, my inclination is this is ethical, and there's no problem in that, because what will happen is that the whole of the sections will get filled with the text which you will write yourself. You're not going to let it filled by AI generated content. These will just convert it to your bigger headings. And then if you, wherever possible, for example, अब आप differential diagnosis को तो आप paraphrase नहीं कर सकते, right? Severe complications को, तो wherever possible, you can paraphrase it and you can let it go. I would say that. But I don't recommend using a humanizing platform. Okay. Any other questions before we move forward? Because now it's going to get interesting. Okay, I'm going to move forward. So what I can do is that I can take a section of this, okay, and I'm going to copy it in the chat. Okay, so what I did, from the outline which it created, I took one section, I pasted in the chat, and I said create content for this narrative review for this section. In between, it's also talking about history as well. Somebody raised the point of history. So now it's generating content, but it's lacking references. Okay. Okay. So I'm not happy because it does not have references. I assume that I'm okay with the text. You have to just go through the text and see whether that's correct or not. But let's assume the text is fine. I will say give references to each sentence written in the introduction section, include in text references as well as list of references in the end. Okay. So now what it's doing for each point, it's having the proper reference, and it will have a list of references at the end. Somebody's hand is raised. Let me finish this point. I'm going to come to you because this is a very important point over here. So we pretty much have one complete section for the article written in less than 20 minutes, right? And then there are references as well. Now, what do you think? Now, there is one caveat. These references may not actually be real. So some of them, these references will be true. Some of them, they may be ChatGPT may be creating, and the articles may not be there at all. So I'm just telling you, and this phenomena where ChatGPT, when you ask ChatGPT something, and if it creates it from itself, it's known as AI hallucination. So that's a side note, but that's there, right? So now the question over here at this point is that can I use all of this content and submit it as part of my writing to a scientific journal? Is it ethical to use this content? Yes or no? Okay. No, 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 no. Okay. I'm still waiting for anybody who thinks it's ethical to use it. Okay. Somebody said, okay. So it's somebody saying that no without verifying the references in context. One person saying yes with paraphrasing. Okay. Okay. So one thing is that I will not recommend doing it. You can do it. So essentially what we can do is that we can pretty much create a whole of the article in the next hour by pasting it in individual section and letting it write a article for us. But should I be doing it? I'm inclined towards not doing it. Okay. But some of the platforms, including some of the scientific journals, will allow it with some caveat. Okay. One is that, okay, you disclose that you use AI to generate, you explain the whole of the process, and then you have the whole of the snapshot or the record of your interaction with ChatGPT with it. And then you disclose what steps did you follow. If you disclose it, then those platforms will allow it. And those platforms include some of the scientific journals. Majority of the journals will not allow you to do it. Okay. And for those who will allow you to do it, you'll have to explain it and you have to disclose it. And then you have to own the content. For example, you generate this content, you have to review it as an expert. You say, okay, whatever it is written, it's saying that it's from reference number 6. You go to reference number 6, you see whether that article actually exists or not. And the point which is there, which has been quoted from reference number 6, is that present in that article or not, right? You have to go through whole of this process for all the articles. And I think that's a lot of work. So what I think is, my opinion, it's easier as well as ethical to use the outline, use ChatGPT for creating the outline, but I will not recommend creating scientific content using ChatGPT, because it becomes a lot of more work for you. If you have to use it, then you have to disclose it, then you have to follow the steps that I mean, even those who allow it would allow it that with the condition that you own the content, that you claim that the content which has been generated by ChatGPT is scientifically correct and is verifiable from the resources which are there, right? Okay, I will pause over here and take one question from Mohammed Arisa, and then anybody else who has any question.
Ji sir, you have already mentioned it. The question I want to ask that most of the references I find there are not true. So how we tackle it?
How to?
How to tackle that?
So how to settle is that, I mean, don't use it. Don't use this method. Don't use it for content generation. You can use it to make an outline.
It means we cannot take the true references from AI.
So you can take it if you want to use it. There are two ways to do it. Okay. One is that you verify individual references and whatever it said, and then verify as an expert that it's whatever it said is correct, and then you have to disclose it. Okay. So that becomes a long, I mean, it becomes more work rather than decreasing your work. Rashid sir?
Okay. Yes, Dr. Amir Abbas. Now, in the above article, which the AI has generated, we can ask that it should give reference against each sentence. So then it will be ethical. Because reference is given against each sentence.
Yeah, sir, still, even the reference is given. What I have to do, as I said, that if you want to use this content, you have to first of all disclose to the journal or whatever platform you are. पहले तो कुछ journals आपको बिल्कुल explicitly कहेंगे कि इस तरह content हम नहीं allow करेंगे. वहां पर तो आप कर ही नहीं सकते ये काम, ठीक है. फिर कुछ journals होंगे जो कि AI content को allow करेंगे. जो journals आपको AI content को allow करेंगे, वो आपसे ये expect करेंगे कि as an expert, जो उसने ये पहला सेंटेंस कहा है, आप इसकी यू आर गोना रीड इट एज एन एक्सपर्ट, यू आर गोना approve it or disapprove it, whether this is right or not. And then जो reference है, reference number 1, you're going to go to the article, the reference number 1, you're going to open it and see whether that reference actually exists or not. Okay, ये है a newly discovered, ठीक है. And then you're going to open the whole of the article and then see कि जो पहला point उन्होंने जो इसमें claim किया है, वो actually उस article में वो point भी लिखा है या नहीं लिखा. Right? And then you have to repeat the whole of the process for all the sentences and for all of the references. तो मेरे ख्याल में बहुत ज़्यादा काम हो जाता है. Right? तो उसको avoid करने के लिए I do not recommend using AI for scientific writing. आउटलाइन जनरेट करने के लिए तो सही हो जाता है, लेकिन यहाँ आप आउटलाइन वहां से इस्तेमाल करें और फिर उसको जो है जो ट्रेडिशनल तरीका है उसी के साथ आप उसको यूज करते हुए उस आउटलाइन के अंदर ही अपनी ओरिजिनल आर्टिकल्स के कंटेंट को लिखते जाएं. Somebody with PMA ID has their hands raised. लेकिन इससे पहले राशिद साहब, do you have any follow-up question before we move to the next question?
Yes, that is correct now.
Okay, thank you. So somebody with the PMA ID has his or her hand raised.
No,
Assalamualaikum, sir. I am Vadeed. I am also the panelist of
Dr.
the
Vadeed
webinar.
is the panelist today. Dr. Vadeed is the controller examination in Women Medical College, Ahmedabad, and he is also specialist in artificial intelligence. Dr. Vadeed, yeah, over to you.
Sir, I wanted to ask that what about the insights that we could use, like consensus and size space? What about that? We can use it for referencing insights. Then we can use those references with proper literature ethically. Is that possible, sir? If that we could tell to the audience.
Yeah. So there are other ways. Because in the interest of time, I'm just talking about straightforward ways. There are other ways we can. For example, what I can do is that I can take an article, I can paste it here, I can make it summary. And then I can do the same thing again and again and again for say 20 articles, and I've made 20 summaries, and then I can give as an input, as a prompt to this, and let it to write and synthesize a content based on that. That is one way to do it. It will be still AI generated, but that is having better authenticity. The second thing which you were referring to is use of consensus. Is, for example, I take one piece of information over here. Let's assume, okay, I take, no, not this one. For example, this piece of information, as an expert, I think this is right. I go to, I'm going to open it in the new window so that say consensus is another custom GPT, which is a specialized form of a chat GPT, which will enable us to extract references or authentic scientific articles based on whatever information we give it to. For example, so now what I can do is that's very rightly pointed out, is that, for example, I can give it the initial statement which was given from there, and I can say, please find me reference for this information. And it's taking permission for me to allow it. And so now it's giving me actual links of different scientific articles, which will have that information, which is there. We still need to manually check it, but they're more likely, or rather we are almost certain that they're actual articles, but the information is still required to be verified. So इसने क्या किया है कि जो information मैंने इसको दी है, उसने उसके कुछ references दे दिए हैं. तो आप ये articles actual होंगे, लेकिन you have to go through them and see whether that information which I've shared, which is there or not. I did not want to go in this area because there are other ways to do it, but वो talk थोड़ी सी complicated हो जाती है.
जी, डॉक्टर सामिया रफीक ने इस पर रिस्पॉन्ड किया है. फॉर रेफरेंसेस जनरेशन बेटर टू गो फॉर लिटरेचर सर्च टूल e.g. special, for example, research rapid or lit map. थैंक यू डॉक्टर साइमा, यू आर वेरी राइट। डॉक्टर फारिया मलिक ने एक स्टूडेंट्स के बारे में पूछा है कि वो किस तरीके से जो असाइनमेंट हम स्टूडेंट्स को देते हैं और हम कैसे चेक कर सकते हैं कि इन्होंने एआई से जनरेट किया है।
So to check the assignments for students, you need to
हाँ,
purchase a platform which is known as originality.ai. I'm gonna write in the chat as well. एक minute. I'm gonna. और दिस इज अ प्लेटफॉर्म जो कि प्रोफेशनली
ओरिजिनलिटी पे आते
जर्नल्स इस्तेमाल करते हैं। यू हैव टू परचेज दिस प्लेटफॉर्म। मेरे ख्याल में इंस्टीट्यूशंस को परचेज करना चाहिए, अपनी फैकल्टी को देना चाहिए, क्योंकि जब आप एक जितनी दफ़ा भी चेक करते हैं उसको आपसे क्रेडिट्स चार्ज करता है। ठीक है, सो इट्स नॉट feasible फॉर इंडिविजुअल्स टू परचेज। आई थिंक इंस्टीट्यूशंस शुड परचेज एंड देन यूज इट फॉर चेकिंग डिफरेंट असाइनमेंट्स। दिस इज जस्ट लाइक टर्निटन बट फॉर एआई।
अच्छा, इसमें एक डॉक्टर प्रोफेसर नाबिया तारिक इज ए गायनेकोलॉजिस्ट, शी हैज आस्क्ड that reflective writing assignments are used for assignments. How can we minimize plagiarism? Madam, but
प्लेजरिज्म तो सर
plagiarism from AI
प्लेजरिज्म तो
or
पूरी
all over क्योंकि plagiarism are different things. You mean Professor? Can you?
Uh, Basically, reflective writing basically is to have the insights of what they are thinking and what is their point of view on some specific thing. So if this is so easy to generate the whole stuff, so how
Hmm.
we can use now, how important is to give them assignments on reflective writing or to assess them properly.
Hmm.
Right. So I think maybe I understood the question, and just correct me if I rightly understood the question. The all of the idea of the reflective writing is to make people think for themselves, right? So if this is an area where even the AI detectors will not be able to help you. For example, if you give me an article and you want me to write a reflective note on that article, I can give it to AI. I can generate ideas from AI, and I can paraphrase those ideas, and then I can write those ideas, right? That's somewhere I don't think we still do not have any tool, because जिस तरह से आप किसी की आर्टिकल से कॉपी करके पैराफ्रेज करके, that's not plagiarism, right? So you can, and I think I mean it depends on how you want to see it. It can help you to think quickly, but at the same time, you are more relying on computer to think as compared to your human brain. But the short answer to your question, if I understood your question correctly, is that we do not have a very strong way. If somebody generates content from AI and then paraphrase it and rigorously paraphrase it, then
But
perhaps
that
you
does
don't
not
have
meet
do
the
not
objective. Their own mindfulness and their own thought process is nowhere in this. The
exactly.
problem
That's
is this.
somewhere. I mean,
Exactly.
exactly.
Yeah.
So usme I don't know. We still, so as medical educators and academicians and medical education, we have to come together and think of ways कि okay आपने अगर reflective thinking और उनके thoughts और उसको trigger करना है, so what we can do. To be honest, I don't know at this point in time what is an alternative for that.
Okay. Anybody else? If you answer questions before closing today's session, anybody? Anybody from AJKMC?
सर
सर
मैं
मेरा क्वेश्चन
Yes, yes.
प्रोफेसर अरशद मलिक बोल रहा हूँ सर।
जी जी मलिक साहब, क्या हाल है आपका?
बिल्कुल ठीक ठाक सर। मैं कमेंट्स तो कोई नहीं, इतना कम्प्रीहेंसिव था कि ये सा ग्रेट थैंक्स टू यू सर कि
प्रोफेसर ऑफ
स्पेशली आपने
एनाटॉमी,
इतनी
प्रोफेसर ऑफ
फैसिलिटेट
एनाटॉमी।
किया,
यस।
कितनी आपने फैसिलिटेट किया, और आपकी कंट्रीब्यूशन जनरल पैथोलॉजी और बाकी में तो है ही है। तो जितनी आपने हमें, ख़ास तौर पे मैं एज ए ओरो पैथोलॉजी की बात करूंगा कि जितनी आपने कंट्री वाइज हमें सपोर्ट की है, और यू आर अवर मेंटोर, और
सर,
आपकी वजह से हम
थैंक
यहाँ तक पहुँचे हैं। तो ये
थैंक
भी आपने एक नया टास्क शुरू करके, यू आर रियली अ ग्रेट मेंटोर फॉर अस, और यही मैंने शुक्रिया सिर्फ अदा करना था सर।
Thank you. Professor Arshad Malik was professor of oromaxillofacial surgeon with me in PMC, and now he is acting nowadays as a dean. And thank you, sir. Thank you very much, sir. जी यासिर इसहाक।
सर मेरा क्वेश्चन ये है कि आजकल तो बहुत से एआई टूल्स अवेलेबल है ना, जैसे
Yes, sir.
जेमिनी भी है, तो कौन सा एआई टूल ये रिकमेंड करेंगे जिसमें कि हेलुसिनेशन सबसे कम है, उसके रिजल्ट सबसे अच्छे हैं?
The short answer to that is ChatGPT is still much ahead of all of others.
जी
और
प्रोफेसर अतिया अनवर, प्रोफेसर ऑफ फार्माकोलॉजी, डू यू वांट टू आस्क अ क्वेश्चन? शमसा, प्रोफेसर शमसा हुमायूं। जी मैडम, जी मैडम।
Assalamualaikum.
थैंक यू मैडम जी।
It was very informative session. I must congratulate you and the
So nice of you
facilitator.
मैडम।
मेरा ये है कि can we have the email of facilitator Dr.
जी
Amir Abbas for future?
मैं भेज दूंगा मैडम, मैं भेज दूंगा।
हाँ, क्योंकि अगर कुछ और पूछना हो आपने तो because
जी
new
मैडम, मैं
versions
आपको
are
भेज
coming
दूंगा।
every day of AI, ChatGPT.
जी मैं भेज दूंगा आपको मैडम।
चले, thank you so much, thank you so
सर
much.
मैंने चैट में डाल दिया ईमेल एड्रेस।
चैट में डाल भी दिया।
Okay, so
okay.
there are 3-4 things which I want to go through before we end this session because they are very important. If you allow me, because you can
आमिर,
use
डॉक्टर
ChatGPT.
नुमान खान का क्वेश्चन है। डॉक्टर नुमान खान, व्हाट यू वांट टू आस्क?
Okay.
थैंक यू डॉक्टर हैदर।
Assalamu alaikum, sir.
जी नुमान।
Sir, thank you. First of all, thank you so much for arranging such a nice session. मेरा क्वेश्चन ये है कि मैंने एक पेपर सबमिट करवाया था एक जर्नल में। अब वहाँ से जो मुझे रिप्लाई आया, उन्होंने कहा ये जर्नल, ये जो पेपर है आपका, मेरा ही पुराना कोई पेपर है, उसमें से कुछ पार्ट को वो प्लेजराइज कर रहा है। तो आई वांट टू आस्क, इज देयर एनी एथिकल वे कि मैं उस प्लेजरिज्म को रिमूव कर सकता हूँ थ्रू एआई? यानी जो मेरा ही पेपर को वो साइट कर रहा है और लेकिन वो प्लेजरिज्म में आ रहा है।
The short
Thank
answer is
you.
that you have to manually paraphrase that portion.
मैनुअली
That is known as
पैराफ्रेज।
हाँ।
हर 5वां लफ्ज तब्दील कर दें। सिंपल सा आसान है। हर 5वां एक सेंटेंस है ना, उसका हर 5वां फिक्रा तब्दील कर दें, वो ठीक हो जाएगा।
सर मैं थोड़ा सा इसको 2-3 चीजें हैं जो कि आई वांट टू कवर बिफोर वी एंड द सेशन।
हाँ जी 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 जी।
Okay, so then there are a few other things that you can do. For example, proofreading is one thing. Okay, और हमारी English इतनी अच्छी नहीं होती. So again, some of the journals will allow, some of the journals are very strict. But the proofreading is something which I think should be universally allowed. But at the same time, you should have the versions of your original written paper as well as the proofread paper. So if अगर आपके पास कोई claim करता है कि आपने content AI से generate किया हुआ है, राइट, तो आपके पास प्रूव होना चाहिए कि आपने ओरिजिनल जो पेपर लिखा था वो वर्जन क्या था और फिर आपने प्रोसेस किया था और उसका स्नैपशॉट्स वगैरह आपके पास होनी चाहिए। बट मेरी अंडरस्टैंडिंग ये है कि व्हेन यू प्रूफ यू ओनली यूज ChatGPT फॉर प्रूफ रीडिंग and then disclose it, then that is ethical. You can use ChatGPT for writing emails. You can use ChatGPT for data analysis, and this is very interesting. I want to show to you, for example, if you can see on the screen, there is a tool which is known as Data Analyst. That's a custom GPT within ChatGPT. I've just uploaded a complete data set, and what I'm going to do is that, and this is the most fascinating use of ChatGPT which I've found so far. I'm only uploading an open source data which is named as diabetes.csv, and I'm going to just write to it, analyze this data, and it's going to load it, and it's going to keep on writing the code, and it's going to do the analysis in real time. Okay, so I gave it the data. It's just showing to me that okay, what were the variables in the data set. This is naming the variable. Then it's suggesting me the first next steps. I'm gonna tell it that do one. I'm saying do one. So the next two steps which is suggesting is that do basic exploration, do correlation analysis, and do predictive analysis. I'm telling it do all. Just telling it to do all of them. So the idea is that this tool is an excellent tool provided that you're ethically allowed to share the data with this platform. That is a caveat in it. But if you're ethically allowed, for example, you have a de-identified data which you can share with ChatGPT, then you can do analysis of the data with ChatGPT as well. It is still analyzing. See, within a few minutes,
Even graph
or
and yes.
it has generated the graphs, and you can see it has generated a correlation matrix as well, and it will keep on suggesting the subsequent steps as well. So in the same way, what you can see that it has also generated for you the Python code. For those of you, you can learn Python, you can learn R with the help of this ChatGPT, and there are so many other things. I think in the interest of time, if you don't stop me, I'm gonna keep on going, because this is an area which is very close to my heart. But there are two things which I want to give to the audience. I have a YouTube channel where I teach regularly. This is the link to my YouTube channel. I'm going to put in the chat as well. I teach different topics like these. Some of them are related to AI in healthcare or research methods. I will request, if you want the content over there remains. And there is a series which is there on AI in healthcare. There are 40 episode series which is coming up. And the second thing is I have a web-based a blog which is amir.substack.com. It has around 20,000 subscribers from more than 50 countries in the world. I will request you to visit that as well. I'm going to leave the a link to both of these in the chat. Professor Rashid Saab.
जी डॉक्टर आमिर, पहले तो ये कि इस बात की खुशी हो रही है कि हमारे स्टूडेंट अब हमें पढ़ाने के काबिल हो गए हैं, तो ये एक बहुत खुशी की बात है हमारे उस्तादों के लिए। अच्छा, हमारे पास जब हम एक आर्टिकल लिखते हैं और ढूंढते हैं, उसके लिए रेफरेंसेस ढूंढते हैं, पबमेड से ढूंढते हैं, गूगल स्कॉलर से ढूंढते हैं, कहीं से भी ढूंढते हैं, आर्टिकल तो हम उसका रेफरेंस दे देते हैं। हम ये नहीं कहते कि हमने ये कहाँ से ढूंढा है। तो अगर हमने चैट जीपीटी से ढूंढा है, ठीक है, और उसको प्रॉपर इस्तेमाल किया, तो फिर ये क्यों कहना जरूरी है कि ये मैंने एआई से ढूंढा है, जब हम ये नहीं कहते मैंने पबमेड से ढूंढा है, गूगल स्कॉलर से ढूंढा है। तो ये एथिकली जरा बता दें मुझे।
ठीक है सर। सर इसमें सर एक मिनट, मैं पानी पी लूं, मेरा गला खुश्क हो रहा है, एक मिनट। So the answer to your question, sir, is the way ChatGPT generates content. It predicts the content. So आप इस तरह कह दें कि ChatGPT कहीं से कंटेंट कॉपी नहीं करता। जब आप पबमेड से करते हैं,
हो सकता है वो पबमेड से ले रहा हो, वो
सर वो नहीं लेता पबमेड से।
अच्छा,
वो जनरेट करता है कंटेंट। वो जब भी कंटेंट आप बनाते हैं वो जनरेट करता है। डिफरेंस बिटवीन टेकिंग फॉर एग्जांपल गूगल स्कॉलर या पबमेड या किसी भी साइंटिफिक सर्च इंजन, जब वहां से आप लेते हैं तो वहां पर एक एक्चुअल आर्टिकल पड़ा होता है, आप उसको रेफर कर रहे हैं। हाँ, लेकिन जब आप कंटेंट चैट जीपीटी से जनरेट कर रहे हैं, वो कंटेंट जनरेट कर रहा होता है, राइट?
ओरिजिनल नहीं
अब वो
होता।
जनरेट, हाँ, वो एक्चुअली चैट जीपीटी में पड़ा नहीं होता, इस वजह से आप चैट जीपीटी को रेफर नहीं कर सकते।
नहीं, तो हम ये तो कर सकते हैं कि हमें एक चीज चाहिए, मैं कहता हूँ मैंने मलेरिया पे इंट्रोडक्शन लिखना है, तो हम चैट जीपीटी को कह सकते हैं कि भाई हमें इसके रेलेवेंट आर्टिकल्स ढूंढ के बता दो, बस बाकी हम खुद लिख लें।
बिल्कुल कर सकते, बिल्कुल कर सकते हैं, बिल्कुल कर सकते हैं। वही हमने कंसेंसस में बात की ना, ये कंसेंसस में क्या कि फॉर एग्जांपल जैसे मैं मलेरिया का कहता हूँ, आपका सर्च का प्रोसेस बड़ा इजी हो जाएगा। तो कंसेंसस में आपने कहा आपको मलेरिया इन पाकिस्तान में, आपको आर्टिकल्स लेके थे, तो आर्टिकल आपको ले दिया, आप अपनी इंडिविजुअल आर्टिकल्स में आप गए, एंड देन यू आर गोना एक्सट्रैक्ट द रेलेवेंट इंफॉर्मेशन।
तो ये कि आर्टिकल ढूंढने में आसानी हो जाएगी, टाइम बच जाएगा हमारा।
एग्जैक्टली।
Thank you very much, Professor Dr. Amir Abbas, and we are time हमारा 17 minutes, and over to you, Professor Salman Kunti, to conclude today's session. Okay, Doctor, last question, Dr. Mohammed sir. Dr. Mohammed Ramesh ji, can you ask, sir? You ask the question, sir. This is the last question.
अस्सलाम वालेकुम सर।
जी सर।
सर थोड़ी देर पहले someone asked how teachers can detect if student use ChatGPT for their assignments. Another person asked how student can avoid plagiarism. If both measures are implemented, student might receive 0 mark. Who benefit from this? And if these measures are effective for a student, how can they use ChatGPT for assignment and for research work without plagiarism, especially when they can't afford premium tools?
आप कुछ चीजें ऐसी हैं जो आउटलाइन जनरेशन है, ये चीजें तो आप फ्री वर्जन से कर सकते हैं, राइट? मतलब है कि, लेकिन उसकी एक लिमिट हो जाती है आपके पास कि आउटलाइन आपके पास जनरेट हो जाती है, फॉर एग्जांपल प्रूफ रीडिंग आप कर सकते हैं। लेकिन अगेन अगर आपके यू हैव टू प्रीटी मच go to the whether how much your professor has allowed it. If your professor has not allowed it, if your course then you cannot, then using it is prohibited.
Dr. Amir Abbas, can you give the summary in 1 minute about your talk and your
Yeah,
advice
sure.
how to use AI for you are a student, if you're students, if you're faculty member, what your message today is in last few minutes?
Right. So our topic for today was AI, ethical use of AI for medical writing. And I think ChatGPT is a very good forum to do that. We can do a lot of things that include outline generation, doing literature search, proofreading, data analysis. And with the help of ChatGPT, I think some of these which they discuss are ethical and other are not ethical. The essence of ethical use of this platform is disclosure and responsible dissemination of information. We can also use for data analysis. And I think there is a जो प्रोफेसर राशिद साहब ने जो कुरान की आयत के रेफरेंस से भी एक बात की थी, that I will end with that is the importance is the combination of human and artificial intelligence. That is the gold. If you only rely on human intelligence, I think you will be left behind. And if you only rely on artificial intelligence, still you will be left behind. So the combination of human intelligence with artificial intelligence is something which will take you ahead in your academic and other journeys.
Thank you very much. Dr. Sarma Kundi, Professor Sarma Kundi, can you conclude today's session?
Okay, thank you, Dr. Mulazim Saab. Thank you, Dr. Amir Abbas Saab. It was a wonderful lecture that you gave us. And we learned such good things. And now I know who the specialist in AI is. You've got such a lot of videos. I'm going to review each and every one of them. And that's really going to help us. And thank you so much for sparing this time. And thank you to all the participants who took out such precious time from their Sunday. Hope you have a good week ahead. Thank you, Dr. Mulazim again. Thank you, Dr. Amir Abbas. Thank you, Wadeed. And thank you to all the participants. Have a very blessed week, Pakistan Zindabad. Thank you.
Thank you so much.
Allah Hafiz.
Hafiz.
Allah Hafiz.